When I was younger, I had a very eye-opening experience that showed me just how important CPR and AED training really is. It was Halloween Eve, and my family and I were carving pumpkins in our kitchen like we always do. Suddenly, my sister, who is almost 1, started turning blue and went unconscious. My sisters and I panicked. Luckily, my mom, who was a registered nurse, was able to perform CPR on her, and she survived. From that moment on, I knew that if I was ever going to be in another emergency situation again, that I needed to know how to do CPR. I've been a lifeguard for 2 years and have been CPR certified by working at a daycare and also through my dental hygiene program that I am now currently in. It's just very important to realize that very likely at some point in time CPR or AED could save a life of somebody that you know. So today I want to discuss the need for CPR and AED training and why everyone who is able should become CPR and AED certified and how you can become CPR and AED certified. So first let's talk about why CPR and AED training are needed. CPR stands for cardiopulmonary resuscitation and it is performed on a victim who undergoes sudden cardiac arrest or the heart completely stops beating. Now this is different than a heart attack. A heart attack is when there is a decreased blood flow to the heart and part of the heart tissue dies. AED stands for Automatic External Defibrillator and is a machine that can be used to administer a shock to an already beating heart to restore a normal rhythm. According to Dr. Alton Thigerson, Dr. Benjamin Goley, and Dr. John R. Cromer, 250,000 people are affected by sudden cardiac arrest yearly in the United States outside of a hospital setting. In the American National Red Cross's Lifeguarding Manual, they state that atherosclerosis, respiratory distress, electrocution, and traumatic injury are the leading causes of a heart attack, which greatly increases the risk of cardiac arrest. The American Heart Association, in their CPR statistics article, states that 5,900 children under 18 years of age also undergo cardiac arrest outside of a hospital setting each year. The American Heart Association also says that the leading causes of these sudden cardiac arrest cases in children under 18 years of age include trauma, cardiovascular issues, and sudden infant death syndrome. The American Heart Association also states that only 1/3 of cardiac arrest victims outside of a hospital receive immediate CPR from bystanders. They also say that out of all people who suffer cardiac arrest outside of a hospital, only less than 8% survive. The Centers for Disease Control and Prevention did a survey in 2005 where they found that 92% of all respondents knew that chest pain was a major symptom of a heart attack, but only 27% knew to call 911 immediately and what all major symptoms of a heart attack were. So now that we have discussed the need for CPR and AED training, let's go ahead and discuss why everyone who is able should become CPR and AED certified. The American Heart Association says that few attempts at resuscitation are successful unless CPR and defibrillation are administered within minutes of cardiac arrest. Thigerson, Goley, and Cromer say that CPR can double or even triple a victim's chance of survival before a defibrillator and EMS are available. The American Heart Association also states that even if CPR is performed, defibrillation with an AED is absolutely necessary to restore a normal heart rhythm in a cardiac arrest patient. Thigerson, Goley, and Cromer say that early defibrillation by using an AED can increase survival rates as much as 50 to 75%. Many people may have reservations about learning how to perform CPR and use an AED. However, the American Heart Association says that the ability to perform CPR is based more on body strength rather than age, and that studies have shown that children as young as 9 years of age can learn and retain CPR skills. And if anybody has a reservation about using an AED, just know that an AED provides step-by-step instructions as you use it. So in conclusion, cardiac arrest is a leading cause of death in the United States and more lives could be saved if more people became CPR and AED certified. The American Heart Association says that more than 12 million people, including healthcare professionals and the general public, are trained in CPR annually by their organization. If you'd like to be certified by the American Heart Association, you can visit www.heart.org and sign up for a class near you. The American National Red Cross says that they have over 700 locally supported chapters, and more than 15 million people gain the skills that they need to prepare for an emergency through their organization. And if you would like to sign up for a class with the American National Red Cross, you can visit www.redcross.org. So just remember, by learning how to perform CPR and use an AED, you very well could save a person's life.